Good morning. It is now week 6 of Social Work 670, Grief and Loss Across the Life Cycle. And as always, let's start with our objectives, readings, and media for the week. We have 4 objectives: to identify and discuss developmental considerations in older adult grief, to explain the benefits of facilitating a life review, storytelling, to differentiate between functional losses and social losses in older adults, and to identify and discuss topics relevant to end-of-life care, including hospice and palliative care. For the readings this week, there are 2 chapters in Living Through Loss, Interventions Across the Lifespan. Chapter 12, Grief and Loss in Old Age, and Chapter 13, Interventions for Grieving Older Adults. There are 4 articles. The first is the standards that NASW holds for social work practice in palliative and end-of-life care. And those same standards are gone over in a video that I will highlight in a few minutes. Another article, Telling It Like It Is, the adaptive function of narratives and coping with loss in later life. Life review, implementation, theory, research, and therapy, and introducing the 3A grief intervention model for dementia caregivers. 3 A's are to acknowledge, assess, and assist. There are 2 videos. I mentioned one, and that is a discussion about NASW standards in terms of palliative care and hospice. It goes through the differences between each, when each is called for, and what insurance would cover, and qualifications to work in the field. And a very touching story, one of the StoryCorps stories of Danny and Annie. And they're shown in cartoon form, but it's a touching story from their first date until when Danny succumbs to a rapidly terminal illness. So please look at both of those. The next activity for the week, as is usually the case, is a discussion post. And so, as always, your initial post is due by Thursday with a follow-up between Friday and Sunday. But this is, again, based on the subject this week, based on a loss of your choosing. What is the role of social work in helping older adults respond to loss and helping to ameliorate the impact of change? And describe the type of education you would provide and support other members of a disciplinary team you would enlist to address the needs of family, friends impacted by the loss named in your response to the first bullet. So that's the discussion for the week. And then the next activity is a culminating paper. And this is worth 25% of your grade. You need to go back to the instructions in the Getting Started section, and those that are in the syllabus, and you are going to briefly describe the setting where you are currently completing your field placement, identify the types of losses the clients you encounter in the setting have experienced or are likely to experience. Describe the range of expression of behaviors a client experiencing those losses might express, and how might the observable behaviors be viewed by society. You will look at the challenges, the implications for social work practice, and the resources. This paper is 3 to 5 pages. Remember, this is 3 to 5 pages of content, not including the title and reference pages. The description says you need a minimum of 3 references. These are textbook and scholarly articles, not internet references. And you are following APA format as always, and the rubric is in that section of Getting Started. Also, a reminder that since we are rapidly approaching the end of the class, to make sure you get in any outstanding work, please. You need to do that in very short order so I can have a chance to review it. Even though there will be points taken off because of the late submission, it is still better to get that work in order to improve your overall grade in the course. So old age. Old age gets defined many ways, but this is the time when one is more likely to experience many of the losses we've described throughout the course. So there's more opportunity to have a grief reaction because of the death of a partner, death of parents, children, siblings, friends. You might be you might be asked to raise grandchildren or others' children. In Philadelphia, there used to be a group called ROC, Raising Others' Children, and people were asked to take on that responsibility, even though I've seen people well into their 80s taking on the responsibility of multiple grandchildren. It is not that people want to do this. They do it because they feel they have to keep the children out of the foster care system. But if you've already raised your children and are going through that last stage of your life, you are not looking to take care of someone else's children. In my current church, there's a great grandparents that have been asked to take on the responsibility of 4 infants. So this can be very difficult when you're an older adult. Caregiving for people who are ill, caregiving, again, you could be caring for parents and also children. Living with chronic illness, mistreatment is discussed because unfortunately in our society, just like there is child abuse, there is a great deal of elder abuse. There are losses because of physical decline, sensory decline, changes in mental capacity, and then change in the societal role status. Ageism is alive and well in our society. We used to, when gerontology was first thought of as a practice, one of the primary theories that guided gerontology was developmental, this theory that if you disengagement theory. So the theory was that if that older adults disengage from society, society disengages from the older adult, and then everybody is happy. Well, that theory has been pretty much discredited and replaced by other theories, one of which is activity theory, which is the basis for the senior center concept. And that is the more active older adults can be and engage, the more they will be able to continue to be productive in society. Depression is a huge problem in the older adult population, the number one mental illness that often goes undiagnosed with older adults. There is, again, ageism in terms of treating depression, the feeling that people are old and so they will be depressed. Well, depression is not a normal state of affairs. It calls for treatment just as it calls for treatment if you are 15 or 20 or 25 or 40. We have to be particularly mindful of suicide in the older adult population and older white men who, when they attempt suicide, most likely succeed because of the lethal weapons of choice, which is often a gun, to end their life. So anytime somebody is hinting that through our assessment, depression is what we are facing, then in fact treatment is called for if that person is willing. Depression is very undiagnosed in the older adult, and there is a part of the assessment is looking at whether it is depression or is it dementia? But untreated depression looks just like dementia. And so it requires skillful assessment to determine which one we are looking at. Cultural differences. Many of our, especially our older population, view the physician as being able to do no wrong, so they don't ask questions of the physician. They don't tell the physician when they are having symptoms. You have to pull it out of them, which is why it's good to have someone go to the doctor with many of our older adults so that any questions or any symptoms don't go unreported. It also talks about the reluctance of many cultural groups to engage in treatment, including hospice. If you look at the literature, African Americans are very unlikely to use hospice services because of the distrust of the medical system in general. That instead of trying to end your life gracefully, the system is designed to end your life because of historic racism. So it's a hard sell for people to buy into hospice services. The readings talked about PTSD, old traumas resurfacing, and also the use of reminiscence, which is bringing back a collection of memories. I always say if older adults repeat the same story over and over again, it's a story maybe we should listen to because there's a lesson that somebody is trying to tell us. Life review is much more structured. It is using narratives and storytelling to come to terms with one's life at the end of life, and also to tell your story and pass it on if that is something you are wishing to do. Counseling, psychotherapy, grief work, all are necessary. Again, complicated grief needs to be dealt with older adults, just as it needs to be treated for people who are younger. So with that, have a wonderful week. I look forward to your culminating paper and also your discussion post this week. And if you have any questions, please call me. Either call me. My cell is 215-880-4718. It's probably always faster to email me either through the core shell or norma.thomas13@gmail.com. Again, have a wonderful week.